Have you ever noticed how horses in a parade wear those black flaps near their eyes? They're called blinders. And they actually block sections of the horse's vision so that they can't see off to the sides. Even though I know it's for the horse's protection so they don't get spooked, I still always used to feel a little bad for them. Well, it turns out the horses don't even realize they're missing out on half of their vision. Now, you might wonder how you could be missing your entire peripheral vision and not even know it, but it can happen to people too, especially if they have a disease called glaucoma.
Glaucoma is a disease of the optic nerves which causes slowly progressive vision loss, starting with the peripheral vision and working its way centrally, so you lose from the outside in. It's probably the most important thing your ophthalmologist can do for you is to screen you for glaucoma, because early in the stages of the disease, there's no symptoms, so you may not notice that you're losing peripheral vision. Maybe something as subtle as not being able to see the cars on the side of you on the road when you're changing lanes.
This vision loss is the result of optic nerve damage, but we're still not quite sure why the damage occurs. Risk factors are age, specifically 60 years and older, race. Glaucoma is 6 to 8 times more common in African Americans and is the leading cause of blindness for that demographic. Family history, or a history of steroid use, previous eye injury, severe nearsightedness, diabetes, or hypertension.
The thickness of the cornea can put somebody at risk. If somebody has a particularly thin cornea, they're more likely to develop glaucoma than somebody with a thick cornea. Intraocular pressure, which is the pressure inside the eye, is one of the most important factors, and that's the one that's usually targeted with treatment. So if somebody has chronically high eye pressures, they're much more likely to develop glaucoma than somebody with normal or low pressures.
When someone develops glaucoma, any vision that is lost before the diagnosis cannot be regained. So it's important to see an ophthalmologist, an eye doctor, and screen for it every 1 to 2 years, especially if you have any of those risk factors. Glaucoma is easily detected with a dilated eye exam. And once diagnosed, treatment can begin immediately, preventing any further vision loss with either surgery or eye drops.
The most simple treatments for glaucoma are anti-pressure medications, antihypertensive medications for the eye. They're usually taken at bedtime once a day in each eye. It's a simple regimen. It can lower the pressure 20 or 30% and prevent any future vision loss or stop the glaucoma before it causes vision loss. If one drop doesn't work, you can always add a second or a third drop, but then once you get past 2 or 3 drops, you're left with laser and surgical therapy, which are obviously more involved and have more morbidity, can result in complications.
Glaucoma is a chronic condition, so it has to be monitored and treated for the rest of a person's life. Not treating glaucoma can result in total blindness. Then that horse in blinders would feel sorry for you. I'm Dr. Keller Wortham, and you're watching the eHealth Network. Stay healthy.